Hello and welcome back to the Eunoia Health Tech Podcast, where we explore how technology can not only heal, uplift, but can transform our very lives. I'm one of the co-founders and co-hosts here, along with David Powers. Hi, David Powers.
Hello.
And you're coming to us from where?
Philadelphia.
All right. And I'm coming from Northeast Ohio at this time. And with Eunoia Health Tech, not alone, but together and close to our hearts, we've been on our funding campaign, which was originally launched in January of 2024. It's all about creating a brighter future at this time for the homeless and low-income individuals. We are so excited to share this journey with you, so let's get started. So since January, again, of 2024, we've been on a mission. Eunoia Health Tech kicked off its overall existence in June of 2023 when our doors opened. And then in January of 2024, the funding campaign helped us really want to tackle this big challenge. And we thought to ourselves, how do we help people who don't have a skill, who don't have a job, or even a stable place to call home? And what was our goal? Our goal was bold, but simple, to raise funds to build a homestead in Tennessee with over 1,000 acres to empower these individuals to recreate and transform their lives. So think job training, health access, and tools to rebuild confidence. This isn't just charity, although we are a 501c3. It's a hand up, a chance to thrive. And why does that matter? Well, let's look at the statistics in the United States alone. In 2023, the U.S. Department of Housing and Urban Development reported over 580,000 people experiencing homelessness in 2023 alone. And that's just what they have found. David, what would you like to share on that?
Homelessness is a period of time where a person or a group of people don't have a permanent home. And for whatever reason that is, there should be no shame. There really shouldn't be. But there is. Because it seems like a failure of your part, our part, society's part. And it may not be. So, Eunoia Health Tech strives to address those problems.
I want to hit the National Alliance to End Homelessness. In a 2022 study, David, they found that job training programs can increase employment rates in 40% of the participants that they surveyed. That's life-changing. I mean, picture someone who's been sleeping on the street, unsure of tomorrow, getting access to a program that can teach them coding, healthcare skills, finance skills, small business skills. And suddenly they're not just surviving. They can contribute. They can dream. And they can rebuild. If I left anything out, let me know. But that's the impact I think we're not only chasing here, but we want to be able to continue to share.
But before you have any of that, you need to be able to call a place home.
Tell us more about what is home. We did have and if you haven't checked out our weekly of the 14 areas of living space on X/Twitter as well, we did talk about home and what was it? Living situation. But we're going to lean in even more here. So please take us away.
So, whatever you consider home, you have to have a place that you can put your stuff, lay your head, wash up, and eat. The basic necessities of life. Now, I know in this country we have all kinds of freedoms, but that's not necessarily one of them. I mean, it's not guaranteed in life that you have a home. And that's one of the realizations that I've found over the years. Not having a job does not help. Not having an income doesn't help. Steady income. So, and with everything going up today, except for your income, it is very hard to manage the stresses of finances. And that's what a lot of people are finding out today. I was watching a lot of YouTube videos with Californians moving out of the state because the cost of living is so high. And that can be from anywhere in the country or anywhere in the world. We have refugees that come to this country because they feel that we give the opportunities to be able to make a better life. How that appears to someone is different for each and every one of us. But we want to give you the opportunity to do that.
And that's why, believe it or not, and thank you for sharing that, we're on track right now to fund our first pilot program. And by the end of this year, we are targeting 100 individuals to start. Imagine 100 lives transformed. People who would go from uncertainty to possibility. And this would only just be the beginning. David and my shared vision here with Eunoia Health Tech is a world where no one is left behind and where technology and compassion can team up to solve these big problems. And we're not stopping here. With your help, we can expand to more cities, more programs, and more hope. And the need is urgent. But so is our resolve. Homelessness and poverty don't have to be dead ends. They can be doorways.
Yeah, life is a series of choices that we all make.
And it's cyclical. Isn't that interesting? We make the decisions, they go out into the ether, maybe for, who knows, a day, a month, 6 months, and then they're back. And we still have yet to see, sometimes it's the same solution, right? Sometimes it's not.
Right.
But still that distinction of seeing the then and then the now. And you mentioned one of the discoveries, too, is that the cost of income isn't going up, but everything else is. And that's one of the other discoveries while discovering what else is so.
So that's why I've created a business. So that way I can pay myself a reasonable income
While
for
still,
stuff that
excuse
I
me,
do.
while still paying taxes, right? So you're still able to
Well,
inspire
yeah, I mean,
others.
that's
Hold on,
given.
no, no. I want to acknowledge it. So not only are you inspiring others, you're breaking a cycle, and you're still paying taxes, right?
Yeah,
So am
I'm
I.
being
Okay,
productive.
right. We both have tax. For those who this is your first introduction, both of us, we both have tax returns. Be able to prove what it is that we're saying. If you're really up for auditing that, you can go ahead and contact us. Again, I don't think we've even said this in the past couple episodes. We have a new email address, and if you haven't heard it, it's the same one that may be on the other ones prior. So you can clarify. If you want to write it down, you got a pen, paper. I'll give you a few seconds. So it's the word health as you know it. H is in hotel, E is in echo, A is in alpha, L is in Lima, T is in tango, H is in hotel. So the word health, right? Then we have the letter E as in echo, so E, so it's health E, then the number 2, and then the number 3. So what you should be looking at after all of this is healthE23 at gmail.com. Feel free to email us. We do check that quite frequently. And we've been actually getting a couple different offers here to come on to the podcast. David, I've kind of told you, and I'm still discovering here as it goes, because as we've been around, people are getting interested. And if you're interested, if you know of a guest that would be good for the Eunoia Health Tech podcast, it's amazing. For distinctions here, podcast that came before was the Empowera podcast, right? Empowera.
Mm-hmm.
And a lot of guests wanted to come on to empower us still. David, I think I've told you this too, and I think the distinction we really want to put in And today is not only is that Empower has pivoted as well to help and support Eunoia Health Tech and their efforts, but to see that the overall duality and the sponsorship back and forwards, because there are still episodes of Empower that are that will be released as well, but we have these distinctions again for that own target group. I have 100 lives being transformed by end of year.
That'd be awesome.
And how are we going to do this? Well, the funds we're raising will go straight into action. Let's just say it that way. We'll be partnering with local organizations to offer vocational help. So that could be tech support, culinary arts, carpentry, and then we're prioritizing the mental health support and healthcare access. So again, we're non-therapeutic, but because you can't build a future if you're not unwell. Excuse me, if you're not well.
It's kind of like community organizing, really. It's what we're going up to.
And for those who don't know,
we want to use the existing local infrastructure that's already here. I know very well in Philadelphia that there is infrastructure, but we want to be able to give the opportunity for people to escape the doldrums of city life.
correct, full circle, it is a homestead. It's not in the city.
No, it is out in the mountains, and you definitely need a vehicle to get to this place. It's not bus ready. So
Can you imagine it though?
It's
Imagine
out in the boonies, and out in the sticks,
Yeah.
as they call it. And that's a purpose for that.
Well, this has been quite an episode, David. We've been able to come in, share, I think, what it is not only we've been up to, but our vision. And I think we're going to close this episode here with a call to action for everyone. You can please go ahead and check out Eunoia Health Tech's website to donate, and it'll be dropped here in the overall show notes to our campaign. And every little bit counts. If you'd like to want to know more about it, just the overall nonprofit, you can volunteer and spread the word. You can follow us on all various social medias, because together, we're not just funding this. We're funding futures. This has been the Eunoia Health Tech Podcast. And I want to go ahead, before we do and close here, if we can have our guest. Do you have your empowering quote there, David?
Wellness seeks more than the absence of illness. It searches for new levels of excellence. Beyond any disease-free neutral point, wellness dedicates its efforts to our total well-being in body, mind, and spirit.
And with that, take it with you, this podcast, and these sharing that we've been able to provide in body, mind, and spirit. Wow. Proud to be a part of this, not alone, but together with you here, David. And thank you all very much for listening. And happy Mother's Day if you're listening to this. A little bit late. Let's keep pushing forward for change. From milestone until completion. Bye for now.